Hey guys, how's it going? Today is Saturday, March 31st, 2018. Um, I am about just shy of a week away from plastics. So I just wanted to come and talk to you guys a little bit about last updates. Last video I did, I let you know that I was going to be having plastics. Since then, I've had some follow-up conversations with my plastic surgeon, as well as with my bariatric surgeon, as a matter of fact, for my 2-year post-op. First of all, bariatric post-op for 2 year, everything was great. They're totally happy with my levels from my blood work. Everything's really good. They're really pleased. Once again, they want me to be a member of their whatever superstar program or something, so that way I would like have to sign up and then be available to meet with potential new bariatric patients, people who are struggling to maybe come to a decision about whether or not to have weight loss surgery. Tell them a little bit about my journey, what I've experienced. Certainly, just because what I've gone through doesn't mean that that's what they're going to go through, but just tell them about my experience so far. So I've thought about I might sign up for that. Anyway, overall, doctor's really pleased with everything that's going on, with my progress. He said now's the hard part. He said it's easy to lose weight when you have weight loss surgery. Now I'm in the maintenance period, right? It's been 2 years. Regain can happen, I guess, but now, I don't, there's no reason, I could, so granted, yes, I do have the restriction in place for my stomach. So say I can eat maximum 8 ounces of food at one time. Well, I can eat 8 ounces of, lean protein like chicken. I could eat 8 ounces of pasta and garbage food, but so now it's about making good choices and just perpetuating those decisions. But that's all good. So since then, I've had a pre-op appointment with my plastic surgeon in terms of what to expect. So I told you I'd booked a consult with the surgeon. They kind of went everything at like a 30,000 foot view, like really high level. Here's what's involved. I did ask some more granular level questions, and they answered some of those. We took a couple of days, made a decision, called them and said, okay, we're ready. We're going to go ahead and book it. So we did that. Since then, I had to go into the plastic surgeons and have basically what they call a pre-operative appointment. I recently was out of the country for a couple of weeks. I was in Canada. And then I just got back last weekend. And so actually, instead of having the pre-op appointment, like within a week of me having surgery, we actually had it before I left. Right before I left. So they gave me this huge packet of information of, well, of course, consent forms, but also stuff to bear in mind, from a pre-operative perspective as well as a post-operative care perspective. So I'm not going to go through all of this documentation with you, but I think there's probably some things that might be helpful for you if you're thinking about having plastics after weight loss surgery. So, of course, I had to disclose all the medications that I'm on. I'm on a thyroid medicine, and then the rest are just, vitamin supplements. So they said 2 weeks prior to surgery, I can continue to take all of my vitamins and my thyroid medicine, with the exception of one. I cannot take my multivitamins. So, because there's obviously, like you're not supposed, they give you a list basically. Here are all the things that you cannot take. Here are the things that you can take. So one of the things that I'm not allowed to have before surgery is my multivitamin. And I know that there's a reason why. I can't remember why. It says all herbal and dietary supplements should be stopped 2 weeks prior to surgery. This includes some vitamins and antioxidant supplements, as well as the consumption of any form of green tea. Not sure why, but okay. So about a week ago, I stopped taking my multivitamins. I'm still continuing to take, my calcium, my iron, my thyroid. What else do I have in here? I take extra zinc, vitamin D, and vitamin A. So I'm still taking all that stuff. Just the multivitamins I'm not taking anymore. So 4 days before surgery, they want me to be on a special diet. Now, for those of you who have gone through weight loss surgery, you probably are familiar with the notion of a preoperative liver reduction diet. And if you got through that, guys, you'll be able to do this preoperative diet. This one's pretty easy compared to the last one. So for 4 days before surgery, I'm supposed to have a low residue diet, which is essentially low fiber. They don't want me eating a whole lot of fiber. So I'm supposed to basically avoid raw fruits and vegetables because they're high in fiber. I could certainly have vegetables, but they have to be cooked, broken down. But it's so funny. They give you a list of, some foods that you can eat that you're encouraged to have. And obviously this list is not catered towards a weight loss surgery patient, a bariatric patient, because there's some things. Here's some breakfast menu idea, guys. Canned fruit like applesauce, pears, and peaches. I'm sure there's no sugar in that. Bananas, cantaloupe, honeydew, cream of wheat, grits. I do like grits. Croissant. I'll have a croissant, please. English muffin with peanut butter. French toast. French toast is okay. Low fiber, I guess. Milkshakes, Rice Krispies. Anyway, so they gave you a list of stuff here that you can have. Obviously, I'm still going to do bariatric. Typically, quite frankly, for breakfast, I don't eat a whole lot anyway. I will have a coffee with protein powder, and then maybe a protein drink, and then maybe later on in the day, I might have some eggs, that sort of thing. A couple of eggs or an omelet or something like that. So I'm not supposed to have raw fruits and vegetables. I'm also not supposed to have nuts, seeds, or whole grains. Dried fruits are also something that you should avoid. But typically, I don't eat that stuff anyway. So they do encourage you to have beef, chicken, eggs and cheese quiche, fish, hamburger, macaroni and cheese. Hello. Yes, please. Meatloaf or meatballs. I don't eat that. Pierogies. Potatoes are okay, but with no skin. So they say baked, mashed, scalloped, or salad. Poultry's okay. So anyway, there's a lot of stuff on here that I can't eat. Just the net is avoid raw fruits and vegetables, as well as nuts, seeds, and whole grains, and dried fruit. So I'm supposed to do that for 4 days prior to surgery, and then the day before surgery, I'm supposed to have liquids only. So I'll have some protein shakes, I'll drink tea, coffee, and I picked up some soup. So I'll have that for the last day. So no big deal. And then, of course, standard procedure. Nothing after midnight, the night before. So they give me this crazy list of stuff to do. And they kind of count down backwards, probably the same way they did before weight loss surgery, right? So they say 3 weeks or more before surgery, you need to do these sort of things. Like make sure you do, you have good eating choices, stop smoking, book some time off of work, prepare and plan for it. 2 to 3 weeks before surgery, you're supposed to fill all your prescriptions. So my surgeon gave me a lot of prescriptions, which I had them all filled before I went to Canada, actually. So he gave me, let's see, can I reach any of them? So he just gave me a whole bunch of things, and they're for different things. Some are for nausea, from a post-operative perspective. Some are antibiotics to help stave off infection, because I'm going to have so many incisions. But they gave me a great big bottle of liquid hydrocodone, excuse me. So this will be my painkiller. So they gave me one great big bottle of this. And actually, I don't know why. So they gave me this great big bottle, which is full, like, to the tits. And then another little bitty bottle with just a little bit in there. So in addition to that, they gave me an entirely new prescription for refills for both of these. They said that they did not want me to fill them right away because insurance would say no. Because why are you getting all these drugs, Amy? You don't need all that right now. So they said, go through all of this first. And in this particular bottle, it says that there are, it's 500 quantity. Oh. It says take 15 to 20 milliliters by mouth every 4 to 6 hours. And there's 500 milliliters in this thing. So he gave me an entirely a refill of that. But he said, once you get through this, then fill the other one. He just gave me a paper prescription so I could just take it there. I didn't have to go all the way into the surgeon when I'm all like, loopsy-doops and, in pain. So I'll get that filled. And he did say you will go through all of the painkillers, probably. It's a really good chance you will. So anyway, so that was the next thing, you know, in 2 to 3 weeks before surgery was to fill all your prescriptions. They also said purchase some medical supplies, like some 4x4 gauze pads, some antibiotic ointment like polysporin, get some Hibiclin soap. I will use that the night before surgery as well as the morning of surgery just to help. It's like an antiseptic wash they'll use in the shower just to make sure that I'm clean and as clean as possible before surgery. And then it says stop taking the following for the duration of your surgery, like garlic supplements, green tea, fish oil, estrogen supplements, things like that. I don't take any of that shit anyway. Don't overdo it as it relates to fitness. Don't avoid anything strenuous that could potentially cause injury. No smoking, of course. That same sort of stuff. So now we're in where I am right now, 1 week before surgery. They're going to give me a call to confirm, you know, what time to arrive at the hospital. So as a matter of fact, the hospital has already called me, and they told me that according to their records, you know, I should be there at 6:30 in the morning and for an 8:30 surgery. But they said, you know, my doctor's office will call me probably a couple days beforehand just to confirm all that same sort of stuff again in case anything has changed. Let's see what else. Oh, about 2 to 3 days prior to surgery, I'm supposed to either wax or shave my bikini area because they're going to be lifting, they're going to be giving me a mons pubis lift. So, you know, my little girly bits, they're going to be lifting that up considerably. And actually, as a matter of fact, they're going to be removing some of the skin where I have pubic hair. So I'm going to lose some pubic hair. Woohoo! So they say that you're supposed to either shave it or wax it. So I think my surgery's on a Friday. On Tuesday, I have an appointment for a Brazilian, and so I'll get that all taken care of. Do not shave the day before or the day of surgery. Okay, so we're up to, that was 1 week pre-op. 1 day before surgery, I need to pack my bag for an overnight stay. Shower with the Hibiclens, the antiseptic stuff. Cleanse from neck to toes to reduce bacteria. It says shampoo your hair. Do not use any skin creams or moisturizers. Do not use any deodorant, hairspray, perfume, or cosmetics. Remove all fingernail and toenail polish. Oh, toenail polish. I didn't realize that. I'm going to get my nails done beforehand. I'm just going to have them do clear. So instead of just color. So, and I've already confirmed with the doctor that clear nail polish is fine. But now I just realized that I got to get my toenails done too. So I'm going to have to get those taken off. And that's, for those of you who don't know, they have to be able to see your, when you're under general anesthesia, they have to be able to see your nail beds to see if you're getting enough oxygen while you're out. So they need to see your nail beds. That's why they have to have no polish or clear so they can see those nail beds. Okay. I'm supposed to remove all piercings, which isn't that big of a deal. I have a nose ring and, well, I never wear earrings. I only wear big dangly ones, but so no piercings of any kind. Do not eat or drink anything after midnight. Okay, the day of surgery, nothing by mouth. Don't or drink or eat anything. And as a matter of fact, so I got the pre-op call the other day from the hospital. They told me that I'm okay, no food after midnight, but I can have clear liquids, okay, up until 2 hours prior to my arrival. So that would be 4:30 in the morning. They said, on the morning of, I can take my Synthroid for my thyroid medicine, but I shouldn't take any vitamins. So if I need to take a sip of water to take my thyroid medicine and that's it, that's okay. What else? Of course, same old stuff. Don't wear cosmetics, jewelry of any kind, contact lenses, or hair clips, blah, blah, blah. Wear comfortable, clean, loose-fitting clothing. They recommended that I bring a top, not one that, you know, you pull over your head, but one that zips up so that way it's easier to get on and off. So that's everything up until day of surgery. They said I will be on the OR table for probably 7 to 8 hours. After that, I will be moved into a regular room where I will spend the night, and then the next morning I will meet with my plastic surgeon for technically my first post-operative follow-up, and at that time I will be discharged from the hospital and get to come home. So, and now we get into all the post instructions. Look at all the highlights on here that they went over with me. And I didn't highlight this. They told me, here's all the important stuff. So all of the stuff is like typical post-operative symptoms. So they say, signs to watch for. You're going to feel tightness and stiffness in the abdomen, buttocks, hips, and thighs, bruising, swelling, or redness, tingling, burning, or intermittent shooting pain. Sounds lovely. Hopefully this will help me get through it. A nice little cocktail of hydrocodone. They said don't be surprised if you feel that the sides of your body are asymmetrical in terms of their healing. Both sides of your body will heal differently, so they will heal at different rates. So don't let that alarm you. Call the office immediately if you start feeling any of the following symptoms, blah, blah, blah. Let's see, what does it say here? You need to rest, but don't be on bed rest. Rest is important. You need to spend 10 minutes every 2 hours moving around a little bit. They said you have to be very careful when you move. So this is going to be particularly difficult for me because I'm fast. Everything that I do is fast. I talk fast. I move fast. I work fast. I'm just a really fast person, really fast-paced, high energy. They say you have to be really careful with your movements. You have to be very deliberate. It says your incision is going to go all the way around your back and your abdomen, like 360 degrees around you. You can use a walker or a cane. I do have a walker here at the house. We'll see if I need to use it. If I do, then I do. They said you have to keep your legs elevated for lower extreme swelling and when you're not moving. They say, because you need to make really slow, deliberate movements because of all these incisions and everything, it's going to be easy to pop a stitch. It's going to be easy to overdo it. And you're not going to know until it's too late. They said when other people are assisting you, like my husband or my sister, I'm not sure if I told you, my sister's actually flying here next week and she's going to help take care of me, which is great. So that way when my husband can go back to work and he doesn't have to worry about, shit, is Amy okay? Does she need help during the day? So my sister's going to be here taking care of me. And quite frankly, I'm going to have a lot of incisions and I'm going to be in, vulnerable positions. And I don't really know if there's anybody in the world that I would really trust to help me with that other than, my husband, my sister, or my mom, and these are things like helping me get to the toilet, helping me get on and off the toilet, helping me in the shower, taking a look at my incisions. Like, yeah, sure, there's some incisions that I'm going to be able to see, but there's going to be incisions behind me and I can't see it. That sort of stuff. So she's going to come and that'll be great. But it says you need to be careful when other people are helping you because they could pull too hard, jerk too hard, or push too hard. Not, intentionally, of course, but that could hurt. It says you need to sleep reclined with your head and chest slightly elevated above your lower body for 2 weeks. They say, a lot of people seem to say that they sleep in a recliner for 2 weeks. Well, I'm fortunate that I've got a bed that kind of has an adjustable base. So hopefully that will be okay and that will help me. All this sort of stuff, good nutrition, take all your medication. So as I mentioned, you're going to have a compression garment, right? And it's, for me, because I'm having a mastopexy as well as a lower body lift, it's basically going to be like a full-on fucking bodysuit, from my neck down to my thighs. And I have to wear it every day, 24/7 for 6 weeks. And that's supposed to help with swelling and help promote healing. So the only time I'm not supposed to wear it is when I'm bathing, like having a shower, or I'm washing it. So there's only one. I'm going to see if I can get another set too, so that way I can swap them out. Because 6 weeks, 24/7. Okay. Don't smoke and relax. Okay. Day after surgery, we talked a little bit about that. And then I'm not going to get into all the nitty gritty of this because I imagine I'll probably do another video post surgery to talk a little bit about this. But it's things like, how frequently to change your bandages, how to manage your drains that you will have, how to measure the output and, reset the drains, and how to cleanse, the drain areas, and how to take care for the incisions, how to care for your belly button. It's so weird. They're going to have to move my belly button because right now it's covered in excess skin, and they're going to have to move things around and still try to keep it central, and, how to take care of it and try to ensure that there's not bacteria that's getting in that belly button and, creating gross stuff. I can't do any exercise other than regular walking for 6 weeks. That's a long time. And I'm kind of okay with not doing any exercise, but I'm worried about getting back into my exercise routine afterwards. It's going to be quite difficult, but I'm motivated and I think it'll be okay. Okay. And then again, so those are just the first 2 weeks of post-surgery, and then they give you, further breakdown what to do between weeks 2 and 6 following surgery, and then 6 weeks following surgery, 3 months following surgery, and then within your first year. So, I'll certainly do another post-operative update for you guys, but I just wanted to go through all this. Like, my doctor seems to be really good and pretty thorough in terms of, setting expectations for me. Here's what to expect. And I'm so glad that I have it all in writing too, because I don't know, when I went in for that preoperative appointment, it lasted about 2.5 hours. It was me and my husband, and it was just information saturation. Like, we started from basically this documentation. It was like, okay, 3 weeks before surgery, you have to do all this shit. 2 weeks before surgery, do all this. 1 week, day of, like, and then it just went like, it was just this huge span of time with all of these requirements, and I was like, how on earth am I going to remember all of this? I've already forgotten. Like, I've already forgotten. It was a mess. So, so it's great that they gave it all to me so I can keep it all together in my little documentation. So, and then what else do I have in here? Oh, I have my consent forms for my 2 different procedures. I have a list of questions. Let me see if I have any questions here that I had asked that you guys might be interested in. So I asked them, I see, and I'm in some Facebook groups about, people who have had plastic surgery after weight loss surgery. And a lot of people mentioned muscle repair. Oh, I just had a tummy tuck with muscle repair. So I asked him, I said, like, what is muscle repair? And am I getting at that with my procedure? And he said, yes, you are. It's part of the procedure. And it's basically, it's going to be a tightening of the core muscles, which is great. I think I mentioned in my last video, but that's what muscle repair means. He's like, it's not like your muscles are damaged, but we're going to re-tighten those core muscles for you. So, cool. I asked him about my breast lift because there's a few different methods. I asked him, I said, am I going to be getting the anchor method, which is essentially, so if here's the nipple, there's a line that comes down, and then there's another one that goes underneath. So it looks like kind of like an anchor, like a ship's anchor. He said, I will not get that because I don't have enough sagging to require that type of surgery. He said, I will have the lollipop, most likely, which is essentially, circle around the nipple and then just one line that goes down. So it looks like a lollipop. So he said that's what I'm going to most likely be having. Until he gets in there, we'll see, but he's planning on doing a lollipop. Once again, I said clear nail polish is going to be okay, so I can do that. I asked him, I said, I understand that I'm going to be in this compression garment and I'm going to be in pain and kind of doubled over for a good long time. What does that mean as it relates to my monthly cycle? Am I going to be able to wear tampons? Am I going to have to wear pads? Am I going to be able to, bend over enough to be able to change things? And they said that'll be fine. I'm really fortunate, actually. I'm on my last day right now, so I'll be just finishing, really, probably a week out when I go in for surgery. So I'll have, 3 weeks probably under my belt before I have to start worrying about that again after surgery. Let's see. I said, how long before I can have sex again? And he said about 2 weeks. He said, probably you should wait for the drains to come out. Can you imagine, like, getting down with your husband and you got drains coming out of your body? Oh, I was going to show you. I'll show you next time. I bought this cool, pretty little lanyard, so that way when I'm in the shower, I can clip my drains onto it. So I can get in the shower and still be able to, I'm like, what am I supposed to do with this thing, these drains that are coming out of my body? So I'll show you guys that later. Not my drains, but the lanyard, the cool lanyard that I got that goes around my neck that I can just clip them onto. But anyway, no sex until the drains are removed. He said probably about 2 weeks. To be honest, I'm not sure how ready I'm going to be to get down after surgery anyway. But it's good to know. And I said, when can I have a shower? He said, you can have a shower the next day. He said, you can't have any baths, like you can't be soaking. Don't have a super long hot shower. But you can have a quick shower. And I remember after I had my weight loss surgery when I got home, Oh, that first shower I had was glorious. It was the best shower. Sorry. Neat. Sorry, I'm thirsty. All this talking, I'm so thirsty. Let's see. I think that's the majority of all the questions that I have. Oh, they did recommend that you start taking like a stool softener maybe a couple days before surgery, because they said often, you know, the general anesthesia or whatever can cause constipation. That's never generally been a problem for me, but they recommend like taking like Dulcolax or Colace, you know, probably 2 tablets 3 days prior. So for me, that's probably going to be like Tuesday or Wednesday. I don't know if I need to. Like I said, I've never really been affected too much by constipation, but they say that it's sometimes it's an effect of the anesthesia that you can't get constipated, and we'll see. I probably will do it. I mean, if that's what they recommend, I'll probably do it. But if I shit all over the place, then that's on them. No. I think that's it. Yeah. And I think that's about it for now. But I just kind of wanted to go through this. As I said, you know, there's been all these instructions about, you know, 3 weeks, 2 weeks, 1 week prior to surgery. And I've been reviewing it myself, just making sure, did I forget anything? So I thought that I would come and talk to y'all. And I've been blathering on for 26 and a half minutes now. And I think that's pretty good. I'm sure you probably got information saturation, or you probably don't care. I'm just trying to see. Oh, so one last thing before I do let you go. So they give me all this pre-operative and post-operative instructions, which is good. They also gave me some instructions in terms of drain care, you know, how to manage my drains and all that stuff. Excuse me. And they also gave me some information as it relates to post-operative care and what to expect, what they find. So they say that the first week, it's kind of an emotional roller coaster. You're still getting used to the changes, and it's still relatively new. The novelty hasn't worn off. They said the second week, you become, quite frankly, you get bitchy. You're really cranky. You're really irritable, you know, because you've been uncomfortable for a while. You just, you know, you've been sleeping, sitting up for a while. You want the drains out. You're just really, really nitpicky. Which is going to be the best thing that my sister's here, because I can yell at her. Well, it's not that I can't yell at my husband, but they can share the brunt of my fury. So they say second week is probably the worst out of all the stuff, just because the novelty's worn off. You're just tired. You are done with the damn drains. You are done with everything, and you're just grumpy. They said the third week is like show off. So they said that's when you're going to start feeling a little bit better. They said from a swelling perspective. So this chart down here, I'm not sure if you can see, is swelling, what to expect. So they said it will get worse before it gets better. So there's the day of surgery. Day 1's not too bad. It looks like the peak is going to be day 2. The full first, first is day 2. That's going to be the peak of the swelling. And then it'll start to go down from there. So, yay, tons of fun. And that'll be probably a week from today. So that was kind of good in terms of what to expect. What else did they tell me? Sorry, I told you I've got a lot of documentation here, guys. Constipation. It says, sometimes simply having surgery may predispose you to constipation. This is often exacerbated by commonly used but necessary pain medications, right? So it's not just the general anesthesia. It's all these fucking pills that I'm going to be on. So that's why they recommend taking that Dulcolax and the Colace. Avoid salty food, drink lots of water, eat lots of fiber, but avoid foods that you know make you bloated and gassy, such as carbs. Treatment. If more than 3 days pass without a bowel movement, please try these simple remedies. A suppository. An enema. Okay, so I'm just going to go ahead and call it. I'm going to take the Dulcolax or the Colace because I'm not really feeling a suppository or an enema. So let's just stay proactive. And then they give me a little log sheet for all of my medications. I typically just use my phone, but it looks like, you know, the last time I take nausea medicine, the last time I took painkillers and all that sort of stuff. So it's pretty cool that they give you lots of documentation that I think is going to be quite helpful. And it's just a matter of keeping this with me and just kind of constantly reviewing it, staying fresh, because there's a lot of information. It's very easy to miss something. All right, guys, I think we're good for now. It's been half an hour and I've gone through all this with you. And I'll do another video later, probably after surgery. All right, I'll talk to you guys soon.